Okay, well, I tell you what, we'll get started. As for those that have joined, it is recorded. So the purpose of this meeting, or the purpose of the title, is Talking Research. We are trying to share the research work, the knowledge that is currently going on in the School of Nursing, Psychotherapy and Community Health. Pamela, who will be joining us later, her role is to connect with researchers, students, postgrad students, and just support them in the role, and not for it to be a lonely road traveling while they go through their PhD. So we're trying to be as inventive as we can. So we thought, maybe wouldn't it be nice to hear what other research work is going on within the school. So kindly volunteered up. We have a number of academics here joining us today to talk about their research interests, and we will have a Q&A at the end of it, but if there's anything poignant that people feel that they would like to ask during it, I'm sure a gentle nudge and somebody will stop and we can ask the questions. Thank you for coming along, and thank you for taking the time out. It's brilliant. And I hope, please spread the word about Talking Research. It is a loop module. It is very informal. It is supposed to be a repository of sharing information. It's no exam, it's nothing else. You just need to take from it rather than have to give in to it. But it is only as good as anybody. We're talking about sharing literature, research findings, anything that people feel that would be relevant to anybody taking a PhD track. So it is a loop module, and it's called Talking Research. And please feel free to sign up to it or connect with myself or Pamela at sharon.farrell@dcu.ie or pamela.hussey@dcu.ie. We'd be more than happy to talk to you about it. So without further ado, I'm actually going to get going. First off, we have Professor Anne Matthews, who is going to talk to her about research. And then we have Dr. Carol Barron, Dr. Mary Rose Sweeney, Dr. Sabina Stan, Dr. Sean Healy, Dr. Savash Das, Pamela Hussey, Professor Kate Irving, and Dr. Kumar Sithambaram. Apologies if I haven't pronounced that correctly. But this presentation will be circulated through the Loop page after the event. And you will see that I have linked everybody to their DCU research profile page, just for your convenience. If there's a particular subject of interest that takes your interest, you are more than welcome to connect with that individual after the meeting. So without further ado, Anne Matthews, would you like to start the ball rolling?
Thank you very much, Sharon, and thanks for organising this. It's fantastic. So lovely to see everybody, and hopefully most people know each other, but it's also great to meet new people. So I've been at DCU for 20 years. I was originally and still a registered general nurse and a registered midwife, and then studied social policy and planning, and came to DCU on this power and empowerment study in midwifery in 2001. On a research contract, and that really started, or maybe continued, that kind of research into the health workforce. The purpose of that original study was to try figure out what empowerment is, how it was understood, and that really led to this kind of interest in what keeps people motivated, satisfied, retained in their workplaces. It was for nurses and midwives, and then I studied midwifery part for my PhD. And I just have the one page, and really, I suppose these are the two strands continuing ever since. I suppose flowing on from being a midwife and my PhD, kind of maternal, newborn and child and infant health in particular, mostly related nowadays to breastfeeding, infant feeding and well-being and supports for that. So currently we have a project in Malawi looking at policy implementation related to particularly exclusive breastfeeding for the first 6 months. And any kind of other work I do, like Cochrane reviews, tend to be related to maternity outcomes as well, and newborn outcomes. And then in terms of workforce, health workforce studies, workforce planning, there was the Irish team of the RN forecast study. Anthony was involved, myself, Marcia, and Scott and others, Daniela. That was running probably nearly, well, was it 2009 to 2011, so quite a while ago. But that led us into that kind of world of workforce planning. We led a policy synthesis work package. That was the European project. And ever since then, we've been involved, most of those people, on and off in different ways on the kind of nurse workforce planning. Currently, in that kind of realm, I'm involved with another professional group of hospital doctors and their retention and motivation. That's with was the RCPI. They've moved to the RCSI now, funded by the HRB. Just to say that Ellen Petersey, who's working with me, and I'm working with her on the project in Malawi currently, has just gotten funded for a 4-year project on the workforce, the health workforce in Sierra Leone. So I'm delighted she'll be staying with us for the next 4 years. Again, that's, you know, these kind of issue about motivating staff, and in this case it's unsalaried staff, so staff who work in the health workforce but don't get paid at all and aren't even, you know, listed for pay. So that'll keep us going there as well. I'm her mentor on that. So all my publications, I suppose, have been around those for the last few decades, and looking forward to connecting with anybody who's interested in those kind of areas. And thank you, Sharon.